Hi friends, welcome back to my channel. This is your Julie, and if you are new to my channel, kindly like, share and subscribe, and don't forget to hit that bell icon. So friends, I am here with a new video. So today we are going to discuss about one of the very important topics of the MOH Haad nclex RN question, that is about the Glasgow Coma scale. Even though it sounds very easy, many of us still don't know what is Glasgow Coma scale and how to classify and categorize your patient and do the neurological examination of your patient and score the GCS of your patient. So in today's video we are going to learn how to memorize the GCS. As this is one of the very important questions, I recommend everyone to keep watching and perform GCS on your patients and determine what is the neurological status of his or her patient. So what is GCS? GCS is a neurological examination tool to determine the neurological status of your patient. So how you can remember the GCS? So for me, what is the method I use to memorize the GCS? That is the one I am going to teach you all, so that it's very easy to memorize. So GCS, the lowest score is 3 and the highest score is 15. So if you are getting an exam in your examination option of 0, eliminate it immediately, because there is no score of 0. The lowest GCS score is 3 and the highest GCS score is 15. Now if you are working in an ICU and you are a new nursing pass out student and you just went out for an internship period, you can see that your senior nurses are writing in the nurses notes E4, V5, M6, and you are wondering what exactly are they writing and what exactly does all this mean. So what is E4, what is V5, and what is M6? So these are the categories of the Glasgow Coma scale, that is eye opening, verbal response and the motor response. So it's very easy to remember, because first comes your eyes, so that is your E, and very easy to remember the numbers also, that is 4, 5, 6. So just write 4, 5, 6, and here comes your eye response. Next is your mouth, so your verbal response, and next comes your extremities, that your hands, that is your motor response. So eye, verbal and motor response, 4, 5 and 6. So the score goes like this. The highest score for the eye response is 4, and for the verbal response is 5, and for your motor response is 6. Now let's see how you can remember these responses. So I have a short stories to remember each of the scenario. So if you have to remember the eye opening, just imagine a scenario that you and your friend is planning to go to theater, and you have just called up your friend and told, hey, let's get ready for the theater, we have a movie shot. So when you are going to his or her house and you are saying that your friend is ready, it's a spontaneous response, so you will score number 4. Now next scenario is you are going to your friend's house again, and when you are going there, you are saying that your friend is still sleeping. You have to tell her, hey, get up, we have to go for movie. So by listening to your sound, he or she gets up. So that is, in such a scenario, you will give a number 3, that is with your sound that person is responding. So in what next scenario is, you are again going to your friend's house, and you are saying that your friend is fast asleep, and you are calling her, hey, get up, we have to go for a movie. Not responding to your speech, then you have to give a very big bang on her so that she will wake up. So responding to a painful stimuli. In such a case, when that is the scenario and your friend is awake, you will give a score of 2. And even though you are in next scenario is you are visiting your friend, you are yelling at her, hey, get up, you are beating her, not getting up again, whatever you are doing, your friend is not getting up. In such a scenario, you will give a score of 1, that is no response at all. So that is no response. So your eye opening you will categorize into 4, 3, 2 and 1. 4 is spontaneous, 3 is to speech, 2 is to pain and 1 is no response. So this is how you can memorize your eye opening. Now what about your verbal response? In verbal response, let's remember a small story that is from the newborn to the adulthood period. So you know, in verbal response the highest score is 5 and your lowest score is 1. So you just think of a newborn baby. You are trying to play with the baby, you will not have any response with the baby will not respond to you. So that is 1, V1, no response. Now what, just remember that you are having a 3 to 4 months old child and you are playing with the 3 to 4 months child. So the baby will respond to some, when you are trying to play with the baby will say some of the incomprehensive words, that is like baba, cuckoo. So these are some incomprehensive words. So in such a case you will give a score of 2, that is incomprehensive words. Now V3, that is verbal 3, when you will give a score of 3. Just go to a school age child, that is around 5 to 10 years of child. The child is getting back home from the school and he or she is telling some bad words which he or she has learned from his or her colleagues and they are telling us at home. So that is some inappropriate words. So in such a case you will give a score of 3. So number 3 is inappropriate words. Now number 4 is you have reached your adulthood and you are in a confused state, what you are supposed to do, what you are not supposed to do. So in such a case you are confused, you are giving a score of 4, that is confused. And when you reach your adulthood, you know what you are doing, everything, you know what is the right, what is the wrong, you are oriented to time, place and person. So in such a case you will give a score of 5, so that is 5. That is your V5. So V5 is oriented. So this is how you can remember your verbal response. And now let's see motor response. In motor response the highest score is 6. So in this scenario, let's remember that you are invited for a party by your friend and you have to attend the party. So you are a very shy person and let's see what happens here. So if you are invited to a party and you don't want to go to the party, you will not respond back. So no response, that is 1, no response. So number 2 is you will go to the party, you are a shy person, so you will stand aloof. You will not talk with your friends, you will just stand at one corner and you will not move any of your extremities when the dance is going on. You are not going to move your hands or your limbs, you are just standing straight. That is, in such a case you will give 2, that is abnormal extension. And now what happens is when the dance move is going on and everybody is dancing, so you decide that you will just move your hands. So that is, you will just have a very small movement of your hands, that is abnormal flexion. And next is a friend has seen you that you are standing aloof and he or she is inviting you to dance, and as you are you don't like, you're a shy person, you are standing aloof, when he or she forces you, so it's a painful stimuli, both mental as well as physical. So from your position you are just trying to take your hand away from that friend, so that is withdrawal to pain. In that state you will give a score of 4. And next is he or she has forced you, and on the basis of that force you have just moved from the position you are standing to the dance floor. So that is localized to pain, that is number 5. And number 6 is now there is no option for you, as you have reached there, you have to join them, that is you have to obey the command, whatever they are saying. That is number 6, obey command. So this is the easiest way to remember the Glasgow Coma scale, which I have remembered. Hope this video was very helpful to you. If you like the video, kindly like, share and support. and don't forget to subscribe and keep supporting friends. Thank you for watching. Bye. Have a great day.